starting our patient assessment. Looking at his skin tone, it is a tan in color with dark brown, dark blonde, light brown hair color, evenly distributed. His skin is warm to the touch. It's a smooth texture. It's dry. It's warm. He has a few light brown mackerels, evenly distributed. The palms of his hands are thicker than the thin, smooth texture on his arms, which is a normal finding. Looking at his nails, they are round. They adhere to the nail bed. There's no evidence of clubbing. Approximately 160 degree at the cuticle area. The cuticles are intact. Going to the lower extremities, his hair is evenly distributed. The lower extremities are also warm, smooth. The soles of his feet are thicker, which are a normal finding. His lower extremities are free of edema. And the skin turgor on his feet recoil back in for proper hydration. There is a venous lake on the right lateral calf, and his skin turgor for his hands also is intact where it recoils. We're going to check out his hair. He has dark brown hair, and it's free of any lesions, any bald areas or inhabitants. His head is symmetrical and proportional with his body. Ears are symmetrical, eyes are symmetrical. His eyebrows are brown in color and evenly distributed. He does have a scar on above his left eye, and any tenderness with palpitation?
No.
Okay. Checking out his aeronasal sinuses. Any tenderness?
No.
Alright, his TMJ joint, can you open and close for me? Any tenderness?
No.
There was no pops or clips with that. Next, we're going to test cranial nerve number 5, which is the trigeminal nerve. Can you clench your teeth for me? Clench them. There you go. And then next, I need you to keep your eyes open, and I'm just going to bring this cotton to the corner of your eye, and then we're just going to check your reading. And both eyes blink, which is a normal finding. For that, next we're going to test out cranial nerve number 7, which is the facial one. Can you smile, frown, puff your cheeks, purse your lips? Alrighty, thank you. Okay, and I'm going to go ahead and palpate his pre and post agora lymph nodes, submanual, anterior, superficial, posterior, and supraclavicular lymph nodes. There was nothing palpated there. There was no bulges or masses that could be felt. Next, we're going to test the optic nerve, which is cranial nerve number 2. The vision tests were performed prior to the assessment, the Snellen chart, which measures distance vision, and then the Rom-Bloom test that measures for near vision, and they are noted by like a person with 30/20 reads at a level at 20 that a normal vision person would read at 30. So if you can cover your right eye and tell me when you see my finger.
No. 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 No.
Okay. And if you can do the tip cover thing. Now we're going to look into the eye. We're checking out the eyes, and we see that the sclera is clear, is white. The conjunctiva is clear. There's no exudate around the eyes. The eyes are free of any lag, and they're symmetrical. He has eyelashes that are evenly distributed on both eyes. And I'm just going to palpate the lateral sac and tenderness. And there's no drainage or anything from them. Okay, so the retina has the vessels, two main vessels that branch off. It's free of any hemorrhages. The physiological cuff is present. Checking out this one. The vessels, there's two of them that branch out, and the physiological cuff is present. It's also a pale yellow, and the macula is also noted in both eyes as a yellow with a little pit-shaped center. Next, we're going to check out cranial nerve number 3, which is the oculomotor, fourth cranial nerve, the trochlear, and cranial nerve number 6, abductings. So going back to visualizing the eyes that we just did, if the room was dark when we held up the scope, then we would have seen a readed reflex. We're going to check for the corneal reflex, which is a twinkle in both eyes, the light, and then that is present. Testing for accommodation. Stare here at this. Pupils are equal and reactive and accommodate. And then you can follow my pen light. Very good. 6 cardinal gazes are in position. You follow those positions. Next, we are going to test for, we're going to palpate his neck, his trachea. We're going to listen at the cricoid arteries. No bruise were heard. Very easily palpatable. Next, we're going to check the thyroid. So I'm going to have you swallow just a little bit of this water. Okay, there was no mass that was noted moving up and down as he swallowed. Okay, now go ahead and take another sip for me. Okay, and if you can do it again. Thank you. No nodules were noted. Palpitation, and now we're going to auscultate the thyroid. No breweries heard of that. Next, we're gonna check out the ear, and we're also test the cranial nerve number 8, the acoustic. Looking at the ears, they are symmetrical, they are even in shape. The pecora is noted in the. And then I'm gonna whisper something in this ear. I need you to occlude this ear, and then I want you to repeat what I say.
It's radiance, yeah.
Okay. And you can do the same for this one.
It's cold outside.
Okay. Then next, I'm going to do the Weber's test, and I'm going to hit this and place it on top of your head, and I want you to let me know if you can hear it out of both ears, or your right ear, or just your left ear. Next, I'm going to do the rhymes test, and I'm going to hit it. I'm going to place it here. I want you to tell me when you feel it stop, and then I'm going to move it away, and I want you to tell me when you hear it stop in the air. Okay, that's normal finding. Air conduction is greater than bone conduction by a 2-to-1 ratio. Checking out his ear, it is the meatus is free of any debris. The tympanic membrane has a cone of light reflux at 7, and you can visualize the umbilic pars teres and pars flaccea. Over here, checking out the same thing. Free of any debris. The cone of light reflex on this one is at 7 o'clock, and it's pearly gray. The correction on it, cone of light reflex was at 5 o'clock on the right, 7 o'clock on the left. Next, we're going to test out the cranial nerve number 1, the olfactory. Okay. Can you cover one nostril for me and sniff? Okay, I'm going to do the same on the other. Okay, it's about the same. Okay, if you can cover that side, and then smell this for me. Tell me what you smell.
Vinegar.
Okay. And then, yeah, we can do that.
Vinegar.
Okay. And then if you can cover The cranial nerve number 1 is intact, and we're just going to take a look in the nose. And his membranes are moist. You can visualize the closer turbinates. There's no septal deviation on either nostril. Can you open up and say ah for me? Sorry. Okay, so the buccal mucosa and the gums are nice, healthy pink. The tongue is midline. The uvula is midline. Can you look at the tongue for me? You notice Wharton's glands, the frenulum is mid, tongue, and anchored. The hard and soft palate are intact. There's no lesions. And with this, we are testing cranial nerve number 9, the glossopharyngeal, the vagus nerve number 10. And can you move? Vagus nerve is cranial nerve number 10. And can you move your tongue side to side for me? Thank you. And that's cranial nerve number 12, the hypoglossal. With cranial nerve number 9, the glossopharyngeal, and the vagus nerve, which is cranial nerve number 10, they're also intact, which we can tell his swallow and speaking ability. And then his gag reflex is present as well. Okay. So next we are going to, you can remove your shirt for me. Looking at his chest, it's a symmetrical rise and fall. He has a respiratory rate of approximately 14 breaths a minute. The transverse is 2 times that of the anterior posterior. Any pain with tenderness back here? Any pain or anything?
No.
And if you can turn around to where you're facing the wall, if we can, there's no bulges, masses, or tenderness through here. If you can say 99 for me.
99. 99. 99.
Okay. Now we're going to percuss posterior thorax. Okay, if you can fully exhale for me. Okay, fully inhale for me. Slowly exhale. Okay. Do that again for me. Fully exhale for me. Okay, and then inhale for me. So now we have measured the diaphragmatic excursion. I'm going to also take the chest. Take a deep breath in. You can just turn around so you can listen to the front. Breath sounds are clear bilaterally. We're going to go ahead and look at his cardiovascular assessment now. Looking at him, that he is free of any heaves or thrusts. We're going to check for PMI. First, we're going to check the right and right second intercostal space. And the second, third, fourth left intercostal space. Fifth midclavicular line. And then just below the xiphoid crest. We're going to also, if you can kind of turn, I need you to turn the way you can lean back a little bit for me. Thank you. I'm going to do the same. PMI is at the fifth intercostal space midclavicular line. Now we're going to also take the heart sounds. Check in the pulmonic area, which is right second intercostal space. S1 is greater than S2 is greater than S1. The pulmonic area, which is left second intercostal space. S2 is greater than S1, moving down to Erb's point in the third intercostal space. S1 and S2 are equal. Moving to the tricuspid area, which is between the fourth and fifth intercostal space. S1 is greater than S2, and moving down to the fifth midclavicular line for the mitral valve. And S1 is greater than S2 there. Next, I'm going to test, and I want you to tell me where I'm touching you at. And your eyes are going to be closed. Now I want you to tell me where I'm touching you at. So if you can close your eyes.
Left foot. Right hand. Left hand. Right foot.
Okay. can open your eyes. This is up, this is neutral, and this is down. When I move either your finger or your toe, I want you to tell me which direction they're moved in. Go ahead and close your eyes for me.
Up. Down. Neutral. Down.
Okay. And then this is sharp, and then this is dull, and I want you, when you feel that, I want you to tell me which sensation it is and where. Okay, so close your eyes for me.
Sharp stomach. Dull left foot. Dull right foot. Sharp right hand. Dull left hand.
Great, thank you. Okay. I'm going to place an object in your right hand, and I want you to tell me what it is. Go ahead and close your eyes.
Paperclip.
Okay. I'm going to do the same thing with your left. Okay. Next, I'm going to pat this, and I'm going to place it on your joint, on your like your feet and your knees and your wrists, and I want you to tell me when you feel it and when you feel it stop.
I feel it. Stop. 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 Feel it. Stop.
Next, I'm going to write a number in your hand, and I want you to tell me what number it is.
6.
Okay.
2.
Okay. I'm going to check your process, your temporal pulse, your brachial, your radial, your popliteal just below, above your kneecap, your tibial, and your dorsal peaks. And they're all a number 2 in amplitude. So next, we are going to test your spinal accessory muscle, which is cranial nerve number 11. And with this, we're also testing your range of motion and your strength in your neck. So if you can push against my hand. Good, thank you. Push against my hand. Thank you. And go ahead, and we're going to continue to test the strength and push against my hand. And push against my hand. Okay. Then turn side to side, range of motion, and then shrug your shoulders. Then shrug against my wrist. Okay. Cranial nerve intact. And then go ahead and cross your knees like a lady back and forth. Alright. And then go ahead and stand up for me. Alright. So we're checking out your spinal, checking out your spinal processes too, back here in your neck, they're intact, no lymph node back there. The joints are, they're not warm, there's no crepitus, no redness around them, they're symmetrical. So go ahead and we did the neck already. We're going to test out your shoulders range of motion. So if you can extend them out, go back, go like this, and back like this. Okay. So go ahead and put your arms out, and we're going to go ahead and test your strength. We're going to test out the biceps. Hold them like this. Don't let me pull down. Okay, hold them straight, and don't let me bend over the chest out the triceps. Okay, and the deltoids, don't let me press down. Okay, and the elbows, we saw that he was able to bend and move them, and we would test the strength the same way, so we will not repeat that. And next is the hands. Go ahead and for the wrist, and then bend them down. Okay, and then move them in and out, and then do like this, and then touch the pinky base. Okay. All right. So with your wrist out like this, don't let me pull them down. All right. Don't let me push down. Okay. And then fingers, try to separate them. Okay. And try to close them. Okay. And then push against my hands. All right. And then there. Okay. So you can rest your hands, and then if you can put your fingers to your nose. Okay. And if you can do a dry shut. Okay. And if you can do like this. Alright, and move down each shin. There you go. Alright, and if you can just walk normal for me, like right through here. And okay. Just walk normal, and yeah, miss on the toe. Okay. And then go ahead and close your eyes. Okay, and the wrong part starts with negative. And then turn around so you don't hit the chair. And if you can hyperextend, so if you can move your leg up like this. Okay. And then if you can sit here for me.
Sit.
Or sit like this. Alright, and we're just testing out a reflex, your ankle jerk reflex. Okay. Alright, you can go ahead and down now. And we're going to move to the exam table. And now, since we're midway through, we're going to go ahead and do the room spin. Alright, so to continue on with the musculoskeletal assessment. You're going to go ahead and check out your legs. We're going to take this right one, and I want you to lift it up. Okay. And then I want you to come out and then back down. And then I want you to rub your heel against down through there. Okay, and then take your foot and then bend in. And then we're going to go ahead and test the knee. So go ahead and just bend your knee for me. Okay. And then, so now we're going to go ahead and test the strength. So go ahead and go down against my resistance. Alright? Don't let me push it down. Okay? So with your knee, go ahead and don't let me pull it up. Don't let me push it down. Right. And then with your ankle, go ahead and push up toward the ceiling. And push down toward, look down to, point down to the floor. Okay, and then rotate your foot in, and then rotate it out. And then just rotate your ankle all about. And then go ahead and, now we're going to go ahead and, push up against my hand, so we can go ahead and test the strength. And then push against my hand. Okay. So go ahead and lift up your left leg, out to the side, back to the middle, down the side. Okay, and then out. There we go. And then back down. So we're going to go ahead and test the knee. We can bend it, extend it. Okay. Don't let me lift it up. Alright, don't let me push it down. And then bend your knee. Don't let me push it. Okay. Alright, point your toes on your left foot up, dorsiflexion, down, plantar flexion, point it in toward, there you go, and then point it out toward, and then rotate your ankle. And then push up against my hands, down on my hand. Alright, go ahead and push against my, alright, and don't try to come in. Okay. Alrighty. Then I'm going to listen. So now we're looking at the abdomen. It is flat. It's the same skin tone as the rest of the body. There's some strain. The umbilicus is inverted. It's midline. There's no scars. There's no bulges. No massive present. But before we begin percussion and palpitation, we're going to go ahead and listen for vowel sounds. Vowel sounds are present in all four quadrants. We're going to auscultate the iliac arteries, and then the iliac, the renal, and the femoral. Starting with the right iliac artery. The iliac artery is located on the right upper quadrant, just above the umbilicus, just right of it. Going to the left iliac artery, it is on the left upper quadrant above the umbilicus. Going down to the left renal artery, left lower quadrant below the umbilicus, right renal artery, right lower quadrant below the umbilicus, left femoral artery, and right femoral artery. There was no bruise noted. Next we will perform abdominal percussion during the right lower quadrant. Okay. Next we are going to percuss the liver. And do right midline about the level of the umbilicus. The percussion can be, it reaches dullness, and you mark that. Then we go to the left intercostal space and percuss until we reach it. And mark that. And measure it approximately 2 inches, which is normal. The normal span is 2 to 4 inches. And then we're going to cut the spleen. And then next we are going to palpate the liver. Take a nice big breath in for me. And slow it out. Okay. Now, palpatable, which is a normal finding. If it was enlarged, then that's when we would be able to palpate it. Go ahead and now we're going to palpate the spleen. Go ahead and breathe in for me. And breathe out for me. And the spleen is the same way. It's not palpatable. And then next we're going to palpate the left kidney. Any tenderness into here. You can take a nice deep breath for me. Okay, slow. The kidneys are round, oval shaped, smooth, and any tenderness with that. Next, coming over here to the right one. Take a nice deep breath for me. Blow that out. Okay. Nice and smooth and round. Any tenderness? Yeah. Okay. Right. Go ahead and sit up for me. And this concludes our patient assessment.